Hello and welcome back to my YouTube channel. In today's video, we will discuss about an important histopathology topic that every pathologist should be familiar with in daily practice. Since these findings are relatively common and can sometimes be mistaken for atypical or even malignant changes, understanding them is very essential to avoid misdiagnosis. So now we will study about the viral inclusions in histopathology. And as always, comments, healthy discussions are always welcome in the comment section below because knowledge shared is wisdom gained. So let's go. We'll now first see what are the learning objectives of this video. First, we will have to define what exactly is a viral inclusion. So, in routine histopathology, a viral inclusion is nothing but a distinct intracellular structure which is usually found in the infected cells. Now, this intracellular structure can be either viral replication or accumulation of viral components. Now, this is always seen in routine histological stains, especially it is identifiable in routine H&E stain. Now, sometimes we also use certain special stains in order to confirm whether it is a viral inclusion that we are looking at. After this, the next objective is we will be classifying what are the viral inclusions, and we will also discuss the important histopathological feature of each viral inclusion. So what are the classification of viral inclusions? Viral inclusions have three distinct classifications. So most commonly they are classified as nuclear inclusions or cytoplasmic inclusions or both. So you can also classify them based on if they are eosinophilic or basophilic viral inclusion. You can also classify them based on which organ they usually involve. We'll now stick to this classification, which is the nuclear, cytoplasmic inclusions or both, for easy understanding. Basis this classification, we'll now start with nuclear inclusions. We'll now discuss about the first virus, which is the herpes virus. So, herpes virus is nothing but double-stranded DNA virus. There are two types of herpes virus as we know. One is HSV1, herpes simplex virus 1, and herpes simplex virus 2. So, these are nothing but double-stranded DNA virus which commonly occurs as genital ulcers. Histopathologically, there are three very important features which a herpes virus will show on microscopy. One is margination, another is multinucleation, and the third is molding. So what is margination? Margination is nothing but chromatin margination. And the nucleus will show multinucleation as well as molding. In order to better understand the microscopic features, let us look at this video. So, as you can see in this video, we are looking at a tissue which is ulcerated and it has huge intraepidermal vesicles, as you can see here. So, as you can see here, there are ulcers and that there are huge intraepidermal vesicles. Towards the end of the dermis, you can see a lot of inflammation. Multiple inflammatory cells are present. Now, in these intraepidermal vesicular areas, as we go into the higher power, we can see some cells which are not looking like any inflammatory cell. They look completely different from the typical inflammatory cells or any epidermal cells. They do not resemble anything. Let us go into the higher power. So, in the higher power, you can clearly see these cells have a beautiful multinucleated appearance. So this is what we call multinucleated cells. Now this cell by itself shows very prominent nuclear molding and chromatin margination. This cell itself fulfills the 3M criteria. Now, what exactly is this chromatin margination? It is nothing but an appearance that this chromatin gives because of the peripheral condensation. So, this chromatin has undergone something called peripheral condensation. That is why it is giving a look of a marginated appearance. There is also nuclear molding and there is multinucleation. Now, because of all these changes, these also give a ground glass nuclei appearance. So these are the very important features of the herpes virus. So as we can see further, just to make it a little bit more clear, these are the other cells which show all the three M's. These are all viral inclusions. All these are viral inclusion. There is another very beautiful viral inclusion showing all the three M's, which is chromatin margination, multinucleation, and molding. The reason why I keep repeating this is because these nuclear features are very, very characteristic of herpes virus, so that next time you will not be able to ignore these inclusions if ever you encounter it in your routine tissue section. So, like I had shown you in the video also, this is the herpes esophagitis, wherein you have the three M's: the multinucleation, margination of chromatin, and molding. Here are certain other slides which show multinucleation and margination. Now, there are two types of cells which are mentioned here. One is the Cowdry A cell, another is the Cowdry B cell. So, what are Cowdry bodies? Cowdry bodies are nothing but dark nuclear inclusions which are composed of nucleic acid. So, Cowdry bodies are nothing but nuclear inclusions due to nucleic acid. Now, these are of two types. You have the Cowdry A bodies and the Cowdry B bodies. So, mnemonic for HSV very important for routine histopathologists as well as for exam going students. So, the mnemonic for HSV is herpes makes magic, where M stands for multinucleated giant cell, A is absent central chromatin, which also means chromatin margination, G is the ground glass nuclei, I are internuclear inclusions, and C is chromatin molding. We'll now move on to the next virus which causes intranuclear inclusion, which is called as cytomegalovirus. Cytomegalovirus is a double-stranded DNA virus that commonly affects the esophagus and colon. Most commonly, they affect the endothelial cell, they affect the macrophages, and as well as the mesenchymal cells. In order to further understand their features, important histopathological features, let us have a look at this video. As you can see here, this is a colonic mucosa that appears ulcerated at places. There are a lot of glands which are closely packed to each other with a lot of inflammation interspersed between them. As you go into the higher power, you can see that there are certain bodies which are not very typically found in the colonic mucosa in every routine biopsy. Upon further examination, you can see that they have very typical features, as you can see here. Now this is nothing but owl's eye inclusion by cytomegalovirus. Now, what is this owl's eye inclusion? Owl's eye inclusion is nothing but it's a large ovoid or pleomorphic nucleus, and these are basophilic inclusion. Apart from this, you will also have coarse red intracytoplasmic granules, which are very characteristic of cytomegalovirus. So as discussed before, these are the important histopathological features very characteristic for CMV infection. So as you can see, these are the owl's eye inclusions, and this is the red intracytoplasmic granules. Now CMV has an IHC which is called as CMV immunostate. As you can see here, here are certain cells which have the CMV infected nuclei which show positivity for the CMV immunostate. And over here, this is esophagus where there is CMV esophagitis. So again highlighting the owl's eye inclusions. Now this in esophagus is always present at the base of a ulcer. So that is a very good clue whenever you want to look for the CMV nuclei. So for exam going students and histopathologists again, here is a mnemonic for CMV wherein you have CMV owl. So O is owl's eye inclusion, which is nothing but, like I discussed before, a basophilic intranuclear inclusion, and there is also perinuclear clearing which forms a halo. W is Weiden cell, which is cytomegaly, very enlarged infected cell like I had shown before, and L is nothing but a large nucleus. So the next virus that shows nuclear inclusions is adenovirus. So adenovirus is a double-stranded DNA virus which commonly affects the upper respiratory tract. It is also the most common cause for pediatric diarrhea. So this infection is usually associated with patients who have immunodeficiency, including HIV infections. So mostly the in microscopy, the surface epithelial cells, that is the goblet cells, are usually infected. So it most commonly affects the goblet cells. And here you basically have Cowdery type B nuclear inclusions which have enlarged homogeneous smudgy nuclei. So basically you have smudge cells because they have smudgy basophilic nuclei as labeled here. And they are usually enlarged and homogeneous. They have eosinophilic to ampophilic nuclear halos. So these are cells with eosinophilic to ampophilic nuclear halos, and they are called as smudge cells because of smudgy basophilic enlarged nuclei. So the mnemonic for adenovirus is SMUDGE, smudge. So S is smudge cells, M is markedly basophilic nucleus, U is uniform filling of nucleus, and DGE dark glassy enlarged nucleus. After the viruses that show nucleus inclusions, we now look at some of the important viruses that we should know which show cytoplasmic inclusions. In this list, we'll first discuss a very important virus which is called as rabies virus. So as we all know, rabies disease is caused by the rabies virus, and this is usually from infected, it occurs to the humans from infected animals. So clinically, it presents very two important forms. So first is the encephalitic form and the other is paralytic form. So encephalitic is also called as furious forms, and paralytic is called as the dumb forms. The hallmark histopathological feature of the rabies virus is called Negri bodies. So what are Negri bodies? As you can see in this photo, they are nothing but intracytoplasmic eosinophilic inclusions, which are usually seen in the neurons. So one thing you should know is one of the most common site uh, is the hippocampi and the cerebellum in the brain. Okay, so most common site is hippocampus and cerebellum, and the most classic histopathological feature are Negri's bodies. And these usually represent focal sites of viral replication, so they are also called Lysa bodies, Lyssa, Lysa bodies. So the next virus is nothing but molluscum contagiosum. So molluscum contagiosum, they are from the Poxviridae family. So they are double-stranded DNA viruses which affect the keratinocyte, and the hallmark is nothing but Henderson-Patterson bodies. So let us now move on to this video. So as you can see here, this is a cup-shaped lesion. And this has inverted lobules of hyperplastic squamous epithelium. So this is the hyperplastic squamous epithelium in an inverted shape. As you can see further in this video, inside the dermis, you have these Henderson-Patterson bodies or molluscum bodies, very, very characteristic intracytoplasmic eosinophilic inclusions, as you can see in this video. So this is the Henderson-Patterson bodies. These are nothing but intracytoplasmic eosinophilic inclusions due to molluscum contagiosum. Very, very characteristic. We now move on to the nuclear and cytoplasmic inclusions. So first we will discuss about the measles disease caused by measles virus. Measles disease is also called as rubeola disease. It is an infectious acute febrile illness which causes maculopapular rash and upper respiratory tract infection very characteristically. The highlight of measles virus is the Warden-Finkeley giant cell. Now, what is this Warden-Finkeley giant cell? These are basically epithelial giant cell, and this nuclei will have a single large Cowdery type A inclusion. This can usually be found in the lymphoid tissue. So I have highlighted some of the very important viral inclusions that we'll encounter on routine histopathology, as well as which is commonly asked for the students during examination. So a quick revision for the NEET PG residents. These are the viral inclusions in histopathology. So I had discussed about the different types of viruses and what are the inclusions that are commonly seen. So as you can see here, DNA you have nuclear inclusions and RNA mostly cytoplasmic. Exception is pox virus which shows cytoplasmic inclusions. So these are the nuclear inclusions. What are the common mnemonics and what do those mnemonics tell you? Which are the important histopathological features that you must look out for? The cytoplasmic and measles is both nuclear as well as cytoplasmic inclusions as we have discussed. So as a quick mnemonic or a quick tip for exams, you can remember this mnemonic. Herpes usually cries because Cowdery type A. CMV stares because owl's eye inclusions, and rabies, Negri bodies, it usually ranges. So I hope you enjoyed this video. If you did, please like, share and subscribe to my YouTube channel, and I'll see you in the next video. Thank you.